I think it's only right that we introduce our next speaker. So, I'm going to introduce you to Zorbey Turkalp, is that correct? Absolutely. Now, as a McEuen Scholar, Zorbey came to St Andrews Uni to study medicine from Canada, I believe, and he graduated last year from his preclinical years, and he's currently doing an intercalated Master of Research degree. I don't even know what that is, but it sounds wonderful. Studying the effects of lithium on neurons and how this might impact its use of treatment for bipolar disorder. A couple of interesting things. Another Zorbey's passion is classical music, and he's been playing the piano for 15 years, earning a diploma in piano performance from the Royal Conservatory of Music, Canada. In St Andrews, I believe he teaches piano part-time and is the rehearsal pianist for the Gilbert and Sullivan Society. The combination of Zorbey's career path and his hobby means that he spends a lot of time thinking about the hidden benefits that classical music might have on the brain, and the comprehensive study of literature combined with his own experience, of course, has given him some very interesting and strong opinions on the topic. So I'd like to hand over now to Zorbey.
Hello, can everyone hear me?
Yeah.
Brilliant. Okay. Dementia is a major health problem impacting millions of people worldwide. It is first and foremost a set of symptoms. The primary one being memory loss, as well as word-finding difficulties, cognitive and emotional disturbances. It is caused by a neurological disease of some sort, particularly a progressive degenerative brain disease. And it is a very heterogeneous and very complex disease. And it has a very complex nature and nurture predisposition to it. So because of this, unfortunately, there is presently no cure or uniform approach to treat it. So therefore, the treatment is palliative in nature because it's considered, unfortunately, to be a terminal disease. However, one recent advent has been of personalized music therapy. And this is primarily the type of music therapy that's available in the literature today. And it's been shown to be very good at treating the symptoms of the disease, particularly the emotional ones, rather than the underlying disease itself, in a way. So what is personalized music? So personalized music is a non-genre specific form of music that is primarily incorporated as individualized playlists to patients in care homes. So it's basically someone finds out what type of music that a dementia patient tends to like and puts their personalized playlist. So it's different for everyone, really. So it's meant to appeal to an aspect of a person's memory or emotional context. So there's a very contextual element to it. So it's meant to, say, be triggered from a major event in the past, or something that's associated with a pleasant memory or emotion. So, and it's fascinating because it has a profound effect. It's been shown to reduce agitation, which is a stereotypical behavior in dementia of people wandering and being in a confused state and being emotionally not well. And it's actually been shown to be better than classical music or recreational activity at doing this. And it's even stronger when you incorporate interactive sessions into it. So it's a group, as someone interacting with a person while they're listening to music. So therefore, for this, there's a strong case for its use in everyday life. So say anything from bathing or other daily activities that dementia patients may find stressful, and that carers need to sort of help them with. However, almost all trials that measure primarily emotional symptoms. But when they measure any sort of aspect of cognition, they always seem to report a moderate effect, so not a profound effect. And what's fascinating for this is, I'm wondering, is there a potential for doing these differently? Not necessarily against personalized music, which is unbelievable in what it does really, but also, in addition, could we use classical music as a therapy in dementia for treating not just the symptoms, but rather the disease itself? So there's a whole set of different literature on the independent effects of classical music on the brain, so done on various demographics and various contexts. But my focus is, could we use this as a cognitive therapy? And also, why do I think classical music is so different from other genres, which I'll get to in the future. So I'll start with this amazing phenomenon that we see in musical taste. So what happens is, here's a case study of a 68-year-old lawyer who developed progressive apathy, indifference to his work, and a loss of inhibition, judgment, and seeking abstract thinking skills. These are symptoms of frontotemporal dementia. About 2 years after his diagnosis, he began to listen at full volume to a popular Italian pop music band. Formerly a classical music listener, he had once referred to pop music as mere noise. Now, to clarify, this does not mean that if you listen to pop music, you're somehow substandard in intelligence. I do not mean that. One of the doctors working on the case said that what this may mean is that you require more grey matter to appreciate classical music, and that you don't need so much grey matter to appreciate pop music. So as you use grey matter, your taste in music changes accordingly. Again, this doesn't mean that you're dumb if you listen to pop music. This, however, means that there is probably, this is hinting at there is some kind of profound subconscious interaction of classical music with the brain. That means that there is some level of brain power needed to interpret it on a subconscious level. So, what beneficial effects does classical music have? So I took a look at the literature for this in the context of medicine. So it's been shown, first of all, to alter brain waves. I won't get into too much more detail than that, but it's shown that studies have shown this in children, and studies have shown that in musicians, the same sort of response is actually heightened. People who are trained in classical music. And it's been shown to reduce neuropathic pain. It's been shown to even induce physiological responses such as increase in heart rate or blood pressure, even when the person is in a vegetative state or under surgical anesthesia. So, and it's also been shown to induce a different sort of emotional response. Now, what this means is this is a non-conceptual emotional response that's evolutionarily been described as similar to food or sex. And it's been shown that this is a very sophisticated stimulation of the limbic system, and this is not associated with a memory or emotional reaction. So if you think back to personalized music, what you're looking at is there's a memory, so someone's played it at their wedding, or in a different phase, or has danced to it somewhere, or has headbanged to a rock concert, that sort of thing. But this effect is actually there no matter what context it's in. So as a result of this, classical music is incredibly universal. So whatever your background, the emotional and magical experience associated with listening to it is universal. There was a study that was done on children of varying backgrounds and varying aspects of musical training. And there's a piece of classical music that was played for them. And not only were they able to feel the same sort of emotion that it was trying to convey, but they also could describe the scene it was trying to convey, which was giants walking down a hill. And pretty much everyone in the study was able to describe this happening, which is incredible. So, that's later. So for my final part of my talk, I want to demonstrate why classical music is exactly so different from pop music. And I'm going to do this with a mini sort of music theory lesson on the piano. So, So pop music is catchy in an entirely different way. So basically, it's meant to appeal to the widest possible audience. That is its goal. That is its intention of marketability. And thus, what happens is, when people find out something, even if incredibly simplistic, as like something that most people will sort of like, they market it and they recycle it over time. Maybe some of you have heard of the 4-chord song. That has only a very limited series of progression, but is repeated in so many songs because it sounds nice. So to explain what I mean, so let's have a C. This is a C, and this is the next C over. So let's label the first C as 1, and then 2, 3, 4, 5, 6, 7, 8. You get the idea. So certain notes when you play them together, they sound nice. So 1 and 3. And 1 and 5. But certain notes when you play sound not as good, so 1 and 2, and 1 and 7. That doesn't sound very good at all. So what happens is when you play a chord, so that's 1, 3, and 5, for example, that sounds quite nice. Now, and if you start this on the 5th note of that scale, and then the 6th, and then you have the 4th. Now, to people who don't really study music, have to understand that this is a relationship of the distance between the notes. It's not the notes themselves that is making that sound, it's the distance between them. So say you started on the E and you get the same thing. So let's compose a little song out of it. Sounds pretty nice, right? So 1, 5, screwed it up in the next slide. Anyone? Don't stop believing my journey, yeah. So basically, well, I've done a little bit of analysis here, So basically, those notations there basically say that that's 1, that's 5, that's 6, that's 4, that's 1, etc., 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 etc. So basically, a friend described this to me as the McDonald's of music. Essentially, it's a quick fix, but there's nothing too much substantial in it. So if we get to a Bach piece, so I'm just going to play a snippet of a Bach piece. So that is an excerpt from Bach Partita, which unfortunately I couldn't find analysis for. But another Bach piece, for example, will look something like this. So if you look at that, that is a lot more complex. That is a lot. The harmonies are incredible. And that's the thing. It explores relationships that have not just been discovered as sounding good, but sound good in that specific context. So that one note determines the next note. That determines the next note with some magical ability. So you have choices that are mathematically, they make sense. So my argument for this is this, rather than this, probably has a more subconscious effect on the brain. So there's probably some kind of complex subconscious reaction that you're having to it. And of course, if you have different associations and you have more of your brain being used, these connections may become strengthened over time. So, and if they're strengthened over time, they're less likely to fall apart. So my question is, so why aren't we seeing classical music used properly on dementia patients? Now, to get an individualized playlist, that requires some level of effort. It's very useful, but it does require some level of effort. But if you play classical music for everyone, it's been shown that it's not a conceptual thing. You will get a response no matter what. And I did a quick PubMed search, and I had a look at it, and there really hasn't been any literature on classical music, cognition, dementia, especially long-term from diagnosis to end stage. And also, like, the snippets of literature that are out there, for example, there was a test that was done on healthy controls and dementia patients on category fluency, which is how many things that you can name in a certain category. And it showed that while listening to classical music, you saw an improvement in both controls and dementia patients. So the argument that, wait, in a disease state, you might not get this effect because there's nothing there to work with is not actually completely valid because there's snippets of literature that show that this might work. So, and then my argument for this is, if we generate an evidence base from a cognitive perspective for this, could we then, when patients come into the clinic and they say, I'm really worried about developing dementia as I get older, can we say, if you listen to classical music, there is evidence out there that shows that it might slow the onset of dementia or it might slow disease progression? And that is my primary goal as to whether this can be done in the future.